Well, older adults who take long naps during the day could be showing signs of dementia, according to a new study out by the Alzheimer's Association. Unfortunately, Alzheimer's disease and other types of dementia are one of the leading causes of death in older Americans. I did not know that. In 2020, an estimated 5.8 million Americans aged 65 or older had Alzheimer's disease. This number is projected to triple to 14 million by the year 2060. Unlike death rates from other diseases such as heart disease and cancer, death rates from Alzheimer's disease continue to increase. Now, despite these unfavorable statistics, some evidence has shown that various lifestyle changes can have short and also long-term brain effects. Dr.Anika Toor, she's an internal medicine specialist doctor with Optum, is located in Clearwater, just down the road from us. She's here this morning to talk to us about excessive daytime napping. Good morning, Dr. Toor. How are you?
Good morning. I'm good. How are you?
Fabulous. Thank you for taking time and moving some patients around so you could educate us this morning. We appreciate it.
Thanks for having me.
You bet. So this is kind of a new study that's out. It's kind of alarming. So excessive daytime napping, we're taking little naps, longer nap. It can mean more prevalent Alzheimer's disease for real?
Not necessarily. I mean, excessive napping, which means longer or frequent naps, it definitely can be one of the clues that a person could be heading towards the direction of cognitive decline.
Oh.
And it may trigger, in-person evaluation with your doctor. Although, however, excessive napping can also be seen in other illnesses, including just sleep deprivation or sleep apnea and certain medications like sedatives. So that's why it's very important to talk to your doctor whenever you notice any changes in mood, behavior, or memory.
Okay. So it's okay to take naps during the day sometimes?
Oh, I think naps do offer restorative benefits, more energy. So definitely taking a 30-minute to 40-minute nap every day is okay. Although progression of Alzheimer's in general could be indicated if a person starts to take longer naps or more frequent naps.
Okay. Yeah. Okay. Now we got it. So, Dr. Toor, how common is Alzheimer's disease? It's becoming more common and the numbers are increasing, huh?
Yeah, quite common. Overall, throughout the world, there's 40 million people affected by Alzheimer's, and currently it's the sixth leading cause of death in U.S. adults.
Oh, wow.
So roughly I would say 1 in 14 people over the age of 65 and 1 in 6 people over the age of 80. So it's that common are affected by Alzheimer's, yeah.
So what is the youngest person you've seen with Alzheimer's? I've heard even younger people can get the disease. Is that true?
Yes. Certain patients are definitely predisposed to getting Alzheimer's at an early age, but usually you don't see patients with Alzheimer's before the age of 60.
Okay. So that's not normal. Okay.
Yeah. No. Yeah.
Okay. So how can we recognize the signs of Alzheimer's disease besides maybe taking more naps, more frequent, more longer? What are other signs of it? Can you help us?
Yeah, so the first, usually, Alzheimer's, the signs are so subtle and they are usually not noticed by the patient themselves. And it's usually the family members or the caregivers or friends who notice these signs first because they're so subtle. And one of the first signs is forgetfulness. So much so like leaving the stove on or forgetting where your keys are. Trouble finding words is another one. Sometimes, difficulty making payments or paying bills, difficulty performing familiar tasks, or getting lost in familiar places. It gets so bad eventually over the course of time that sometimes these patients, they lose the ability to carry on a conversation. And definitely there are certain changes in mood and sleep and personality that you can notice in these patients.
So let me ask you this. When someone starts to notice signs of Alzheimer's, how long can those last before the disease is really full-blown Alzheimer's? Just curious. Is that how it happens?
Yeah, it really depends from person to person. Some patients have a faster progression of the disease, but that's the goal. Any sign or symptom that makes you suspect the disease, it should trigger an evaluation by the doctor. So if the caregivers or the patient themselves, they notice any sign, it's better to, talk to your doctor to seek a help of a provider so they can run a battery of tests, including cognition testing, certain blood tests, or imaging tests to diagnose the disease. Because diagnosing it early and accurately is an important step that can improve the treatment or delay the progression.
How long can someone live with Alzheimer's disease, in your estimation? What have you seen?
I would say a couple of years, many years. I wouldn't say it's a very short prognosis or, the lifespan is poor. I wouldn't say that, but a couple of years definitely. And then again, it depends, how the disease progresses.
Okay. Interesting.
Yeah.
So, Dr. Toor, we're speaking with Dr. Toor. We're talking about Alzheimer's and how excessive daytime napping in older adults could mean dementia, some early signs of Alzheimer disease and dementia. Dr. Toor, what causes Alzheimer's disease?
Yeah, here's the interesting fact. We've known this disease for over 100 years, and we still don't know what causes it. But
wow.
The scientists are still researching. Yeah, I mean, this is like really interesting that we still don't know what causes it. There are certain contributing factors that we know of, age being one of them, as we already talked about. The other one being positive family history. So if you are someone that, has a family history that has a parent or grandparent who was diagnosed with the Alzheimer's, you're definitely at more risk of getting Alzheimer's.
Okay.
Yeah.
Now, let me ask you another question. My grandma had hardening of the arteries. Is that the same thing as Alzheimer's?
No, definitely not.
Okay.
So Alzheimer's is basically a neurodegenerative disorder. Here, the disease attacks the brain nerve cells. That's how it, affects the memory and the thinking and the language skills. The hardening of the blood vessels is completely different.
Okay.
Compared to Alzheimer's, yeah.
So, did like a class or something, I remember. Maybe actually it was another guest we had on discussing Alzheimer's. Is it something to do with the amyloid in your brain?
Yes. There is amyloid deposition and there's tau tangles in the brain. These are, abnormal proteins that can form in the brain that affect usually the wake-promoting neurons.
Okay.
That's how, you end up napping more in Alzheimer's.
Okay. How is Alzheimer's treated today? What are you guys doing to treat that disease?
That's another one of the frustrating things about Alzheimer's, that we do not have a cure for the disease. There are some drugs in the market that can slow the progression and mitigate its symptoms, but again, there is no real cure for the disease, unfortunately. But definitely, diagnosing it early, putting the patients on these drugs early so we can prevent the progression. And then there are some lifestyle modifications that the patients can make in their routine, having a pill box, certain modifications in the house, and maintaining just a daily routine and staying active. It helps.
Yeah, and your eating habits good, not eating bad stuff.
Definitely,
yeah. So what else can we do to prevent? We want to be preventative. What other tips can you give us so we can prevent Alzheimer's disease? Things we should do, maybe things we shouldn't do.
Yeah, there are a lot of things that we can do to improve brain health.
Okay.
One of them being staying active, eating healthy, more fruits and vegetables. And the other very important thing that we can stop doing is smoking. We need to quit smoking and drink alcohol in moderation. So adopting overall a healthy lifestyle to improve your brain health, it matters. And again, protecting your brain from falls, from injuries, wearing helmets and seat belts helps. Challenging your mind and brain, doing puzzles, doing crosswords or Sudoku. And so much so like building a piece of furniture or anything that challenges your mind, because you use it or you lose it.
Yeah.
So that's really important. Yeah. So these are very critical things, yeah. And staying socially engaged, being around family, friends, these are all the things that improve the brain health.
How about mahjong? Will that work? Playing some mahjong?
Yeah, definitely. Anything that, just challenges your mind, definitely. Yeah. Cards, any kind of game, anything.
Yeah, pickleball, tennis, golf.
Yeah.
I mean, there's
whatever
so many.
Whatever you like.
Yeah, absolutely.
Yeah, definitely.
Does being out in the heat, does that cause any extra strain on our body and could lead to that as well? I'm just curious because we're in Florida and it's so daggone hot right now.
Oh my God, yes. It is very hot. But yeah, being out in the heat doesn't really cause dementia, but definitely something to keep in mind because you don't want to be dehydrated. So making sure we drink enough water, avoiding times like 10 a.m. to 4 p.m. when the heat is at its peak. That's really important. Or noticing the signs of heat exhaustion, nausea, feeling like you're going to pass out, dizzy, sweating, are all the signs of heat exhaustion. So we want to be very careful about those.
Yeah, and like you mentioned earlier, it's most of the time your friends and family notice, hey, that Carrie, she's getting really forgetful. We need to get her checked out. It's very important that you stay in tune with yourself, your family, your friends, and if there is just a certain little, thing that you're not sure about, there's no shame in going to your doctor and saying, hey, this is happening, help me out.
Yeah. I totally agree with that because I would rather have my patients come to me with a silly question because I don't think there is a silly question. Because it's always better to address any concern you have about this.
Absolutely. Dr. Anika Toor is our guest. Tell me about, you're an internal medicine specialist with Optum. You're located just down the road in Clearwater. Tell me about Optum. How long have you been with them?
Oh, I've been a little close to 2 years with Optum. I started August 2020 with them. I am originally from India, and then I moved here a couple years ago after I got married.
Great.
I went to Pennsylvania, and now I'm here in Florida with Optum. So Optum is a private group which focuses on personalized care and overall patient health. There are a lot of offices with Optum. So we have a lot of inclusive staff to help with patient care, including clinic nurses, case managers, care coordinators, and we have many services that we offer, including same-day triages, sick visits, blood draws in the office, INR checks, IV fluids. We can do IV or IM medications. We can do wound care, and that's just not all of it. There's so much more. The overall goal of Optum is disease prevention, providing the best quality care to the patient while improving patient outcomes.
Okay.
And I think it's the best way to go about medicine these days.
Absolutely. I would agree with that. But you're the expert.
Yeah.
We must remember that. Dr. Toor, thank you for your time. Where can our listeners go and find out more about what we spoke about this morning?
I think the easiest and the quickest way to get more information on this is talking to your doctor. That's the most convenient way.
Okay.
There are other resources definitely online. You can look up on CDC. You can look up on Alzheimer's Association. There are local community resources also as well on dementia, and you can, reach out to them to get more information on. All
right. Dr. Anika, and I like your name. It's not Anita, it's Anika, and that's Uniqua.
Yes.
Dr. Anika Toor with Optum, thank you so much for your time today. Really appreciate it.
Thank you so much. Have a good day.
You bet. Enjoy the rest of your day as well. Thanks.
Yeah, you too. Bye.
All right. Bye-bye.